All right, well, good afternoon. As we promised, we are back. So between the two events, it's a little bit difficult to separate them, and then we had to take a small break. Thank you for being with us. This is American Surgery Center Bariatric Program with partnership of CHRIAS, Christiana Institute of Advanced Surgery. My name is Kemal. I'm the chairman of American Surgery Center, and I have the pleasure of having this session with Dr. Isaias Irgau. Dr. Irgau, how are you?
I'm very well, Kemal. Thank you. Hello, everybody. I am Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is weight loss surgery or bariatric surgery, and I have been performing bariatric surgery now for almost 20 years. My practice, CHRIAS, is by far the most experienced practice when it comes to bariatric surgery or weight loss surgery in our region.
Thank you, Dr. Irgau. So I would like to introduce our other surgeons. So there are, other than Dr. Isaias Irgau, we have 4 other bariatric surgeons. So I do want to point them out, so then it's a little bit different every time. So we have Dr. Wynn, Dr. Peters. So Dr. Irgau, would Dr. Wynn be one of the most experienced female surgeons in the nation?
Absolutely, absolutely. So yeah, when we first started, of course, there were very few bariatric surgeons, particularly performing the modern type of bariatric surgery. But because in general at that time there weren't as many women surgeons as there are now, she would have been one of the very early adopters as well. Definitely.
That is great to hear, and we do support our female physicians as well as we support other physicians as well. But it's a great pleasure to have that in our organization. Dr. Michael Peters, one of the most experienced bariatric surgeons in Delaware and nationwide. Dr. Rose Singh, who joined us in 2014, and Dr. George Ibrahim is part of the team as of 2018. So we do have a colorectal surgeon in the group as well, which makes it a lot more efficient with the shared decision making on different types of general surgery patients and bariatric patients. So having this specialty as part of our own group, it is making it more efficient for everyone else. And to make everything more smooth, we do have our surgical PA, who is part of this excellent team, and as well as our nutritionists who are part of our bariatric program. They most of their time is just designated for patients who are dealing with morbid obesity, so they are the expert in their area. So most of you already know these, and we have so many different videos out there, so then some of them, repeating them may not be as maybe most efficient, but I cannot skip all these with the MBSA QIP accreditation for Bariatric Center of Excellence. This is 10 out of 9,300 surgery centers. Blue Distinction Plus is something that we were able to accomplish. And at the Institute of Quality, these are all bariatric center of excellence in different languages in a way. So we were able to achieve these, and we are proud of our achievements. So now what we would like to discuss today is smoking and alcohol use before and after bariatric surgery. So what Dr. Irgau, what I would like to ask you, and maybe kind of a reminder for our audience as well, is we do case conferences every day, 10 a.m. With the entire team. This morning, we did our 5th one for this week. There were 12 people, nurses, care managers, facility nurses, you, myself, and our practice administrator. So time to time, this issue comes up, smoking. We tell our patients what we expect. Now, knowing, being able to relate to our patients, we know how difficult this is. And sometimes, like, this making that decision, like the fine line, oh, well, I smoked this time, that time. So let's just kind of explain this, elaborate this, spend enough time so those patients can just watch this video. We can actually send this to them, and then they can actually understand exactly why we want them to do certain things before and after surgery for smoking and alcohol use.
Absolutely. Thank you, Kemal. These are extremely important issues, not just for bariatric surgery, but obviously for health as a whole. So let's talk about the easy one, smoking first, right? I mean, in terms of smoking in general, obviously, by now, most people will know that it is very, very bad for health, right? It's something that over time will literally poison a person and shorten their lifespan, right? But when it comes to surgery, particularly bariatric surgery, it is one of the things we insist people actually quit before bariatric surgery. In fact, we tell them that they would not be candidates for bariatric surgery unless they quit smoking about 2 months or earlier before the surgery. This is something that is really something that we insist. And what is the reason? Well, the reason really is twofold. First and foremost, we know that people who are current smokers have a high risk for complications during any type of surgery. And we know that risk is higher for bariatric surgery as well, right? So we say, in order for us to safely take you through to surgery, you have to quit smoking. And then there is the after surgery issue. After surgery, particularly after gastric bypass, smoking actually has very detrimental effects. When we do gastric bypass, we create almost a new connection between the stomach and the intestine. That connection is a surgical connection. It's an artificial connection. It's not a natural connection. That connection needs to heal well and stay healthy. It's called anastomosis, right? It's the entrance from the stomach to the intestine. That anastomosis is critical after gastric bypass. Well, we know that if people are smokers, that connection, that anastomosis will be vulnerable to creation of ulcers. Ulcers are like wounds that don't heal. They cause a lot of pain, they cause other symptoms, but more specifically, ulcers can burst, ulcers can bleed, and that's a life-threatening condition. So we say, we do not want you to have to deal with those issues afterwards. There is no reason, it's not safe. So stop smoking and stay stopped, right? Which means quit early, right before surgery, and stay quit. So not only we're going to decrease considerably the risks of complications of the surgery, but also the person will be healthier, right? What is really most gratifying, Kemal, is for me to see a patient a year out after surgery who comes to me and tells me, look, doctor, not only I am thinner, I've shed so much weight and because I have become healthier, but I'm not a smoker anymore. So with one swoop, I was able to get rid of 2 extremely dangerous factors all hanging over my life, which is smoking and the weight. So having said that, we know it's not easy. People who smoke know that they have tried before and perhaps they have failed. But nowadays, more than ever, there are very different ways to help people stop smoking. And it's one of the things that every health organization encourages. So I encourage people to go back to their primary care doctor and really enlist in different ways in which they can stop smoking. So smoking is an easy one, Kemal. We say quit and stay quit.
So, during my process of learning clinical terms and clinical issues, you are part of a big part of what I learned in clinical world. And the reason is, well, you take your time and you explain it well. And then sometimes we have dumb questions and then you don't make us feel dumb. And then you say, okay, here's what's going to happen. Here's why it's happening. And I think part of it is because you have 4 kids, so then you are well trained to do that. So then, and then we learn, right? So the good news is we are trainable. So, and then you always say that use simple terms so that patients can actually understand. One of the issues when we have a patient with smoke, like if they smoke, we put a smoking cessation. Like if the patient gets that and then one of our nurses call them, what the hell are we doing? Like what is smoking cessation? And why do we want them to complete this on the phone? What does it do?
So that's great. Actually, I'm extremely proud that we have adopted this system-wide approach to tackling this problem, as opposed to just leaving it with the physician and the patient only in one single discussion session, right? We've adopted it, we've made it a criteria that is important. And what we have created really is several landmarks, several steps where we can really look into this issue continuously, as opposed to being faced with a situation, oh, the patient forgot to stop smoking after they talked to the surgeon 4 months ago, right? That's not what we want to be ending up with. So when our bariatric coordinators actually are calling the patients to talk to them about this, they are not castigating them, they are not judging them, they are not replacing the provider. What they are doing is they are adding another layer of support to what the physician is doing when they are helping the patient, right? So what we are doing is we're saying, look, we know it is hard for you to stop smoking. We know also that you cannot go through this process unless you stop smoking. And we're here to support you. We're here to remind you. So if the patient has seen the doctor a month ago and they are still smoking, maybe they have cut down their smoking to about, half of what it used to be or a quarter. Well, it's still not enough. We want zero number of cigarettes smoked, right? And to get to that level, we need these additional reminders, these additional supports, right? So what our coordinators are doing is they are talking to the patients, they're reminding them, but it's not just words. They're also providing them with material that will help them actually achieve this. So we don't want it to be just something that we preach and we forget. We want it to be something that can be practically achieved. And this is something you can achieve when you have a team that has the same mindset and focused in the same way to help the patients achieve this goal.
So, Dr. Irgau, with the smoking, one of the questions that I believe I just received is, what happens if the patient had one cigarette and then they didn't tell us this was a week before the surgery?
So not good at all, right? We want people to take this very, very seriously, right? Now, it doesn't mean that there haven't been patients who called me in a panic and say, well, I just smoked one cigarette today. I'm about a week from surgery. What should I do? Well, I will evaluate the situation at that time and be able to come up with some reasonable solution with them, Kemal. But it's a very serious matter, right? So if we know that the patient has not quit smoking in any way or shape, if they haven't quit completely, we cannot really proceed with this elective surgery. Remember, Kemal, this surgery is very important, right? But if it cannot be done next week, we can do it in 2 months' time, right? So there is not an urgency to that level for the surgery that we can say, hey, it's okay because we need to do this surgery within this time frame. No, it's not okay. So it is very important. So we are not minimizing the difficulty. In fact, when I meet patients that are smokers, Kemal, and I go through what they have to do, I tell them openly, look, of the many challenges you have preparing for the surgery, your biggest challenge is quitting smoking. I'm telling them upfront, and I want them to start working on it quickly. But the way I get patients to buy into this commitment, Kemal, is to make them understand what a precious situation they are aiming for. Be thin and be a non-smoker, right? Huge, huge advantage when it comes to really switching the trajectory of their health in the future. So that is what I bank on. When I really show patients what they are looking forward to when they stop smoking and go through bariatric surgery, they get that, they understand it. Having said that, it doesn't mean that people don't recede back into old habits. They can, but we're here to support them and to help them. It's important for them to be transparent about that, and we will help them overcome that. This is very, very important.
So the best, the mindset for the patient is, you cannot cheat. So you need to be truthful with us, and then we can help. Because as I'm reading some of these things prior to these, just to prep myself, because we do it every day, sometimes we forget what it means. We just do it. So that sometimes it's important to just stop and then see why we are doing it. And complication is one of the very important issues for any type of surgical procedures. And we do not want to be We don't want our patients to deal with that. Also,
Kemal, clearly surgery does have a potential for complications, right?
Mm-hmm.
We know that whenever you are really giving somebody a form of medical treatment, any type of treatment, there are always downsides. There are potential for complications. But what is the goal of a quality program like ours? Why do we distinguish ourselves as a quality program? Because we do everything that is humanly possible to minimize those complications. And we owe it to our patients. And that's why we're proud of our program. So if we don't focus on this very big issue of smoking, then we are really not doing the right thing for the patients as well. So this is important, very important. So there is nothing judgmental about this, right?
That's
nothing
really
at all.
that's
about safety. It's about good outcomes and quality.
So that actually is the relationship that we have with the patient is based on the trust. So we tell them everything that we know, and we expect them to do, and we expect them to be truthful with us, so then we can actually help them with the process. Now, it's interesting enough that not directly related to smoking or alcohol, but it is related to understanding our patients. This week, Dr. I did a couple different meetings, couple different live sessions, and it may be the week for the perception and perspective. As also one of my best friends, you and I, we always talk about perception and perspective. The issues our patients are going through during this process, getting blames, I think the term is fat shaming, right? So getting blamed for being fat. So getting blamed for making the easy decision. I really need public to also understand that you are not telling someone that they have diabetes, so you are not telling them that's their fault. It's a chronic illness. So obesity is a chronic illness. You may be lucky that you don't have it, but if you have it, this is just like diabetes. Do you tell your mother that she has diabetes, so it's shame on her? So you cannot tell someone who's obese and then, shame on them because they have, when we talk about morbid obesity, we are not talking about, like sometimes, Dr. You always, point out when I go up and down with my 15, 20 pounds, I'm in control of that. I don't have a chronic disease. But if I was at a different point, then I have to identify this problem as a chronic disease, which would be morbid obesity. Morbid obesity is not a lifestyle. It's not what you drink. It's not what you eat. It is a chronic problem. It needs to be addressed. So now why I'm telling you this. So Dr. you maybe know where I'm going with this.
Yep.
This patient who finished the process.
Yep.
Process, unfortunately, with some insurances, they require 6 consecutive nutrition visits every month, 6 months. Yep. So she did all those. She did cardiology clearance, she did pulmonary clearance, she did EGD, psych, primary care, sleep study, blood work twice. And the process took about 8 months from the time that she started to the time that she was ready to be, she was scheduled for this Friday. So what happens on Monday, actually this Friday is today, so what happened on Monday in the case conference, they're not able to reach out to her because we had to get the COVID test results. Yep. So then there are 5, 6, 7 messages. And then I tell my people that not to nag the patients. If they don't answer, that means they are telling you. But sometimes I take that communication to a next level and I say, well, I want patients to know why we are calling them. We are not trying to force them. So in our Wednesday meeting with Dr. Irgau, we are having this Zoom type of a meeting. And I said, I'm going to call her. And then she answered. So the discussion, it's about 20 minutes. I felt the pain of what that patient is going through. Yeah. And she said the only reason she's not able to go through, because 1, she's nervous. 2, she's getting peer pressure. Like she's being blamed for getting the easy way out. Mm-hmm. That is so sad. So we cannot do that to our people, our friends, our family members, our people who are in the society. Now, this is, and any other, if you have chronic kidney problem, no one is going to tell you, oh, why didn't you take care of your kidney properly, right? So it's a chronic illness. So yes, there are some factors maybe contributing to this, but there is a big part that's not being controlled by the individual choices. So we need to be mindful of that. Now, this smoking and, why I did bring this up with the smoking and the alcohol issues, because they're already going through so much.
Yes.
And we are already putting so much on them prior to surgery so that we want to have a smooth, flawless procedure. I need our friends, family members to be more mindful of that. Yes. So then you are actually helping them to go through this process. Because, just imagine like for one cigarette, what we are saying is we have to review your process again. You may not be go through the procedure. For pushing that for 1 month, it's a big, huge disappointment for these people. It's almost a reason for depression in some cases.
Yes.
I need people to be more careful with that. So, Dr. Irgau, anything that you would like to add?
No, that's it. I mean, just talking about the smoking, again, one of the concerns patients have as they are preparing is in their experience, every time they've tried to quit smoking, they gain weight. That's true. There is some appetite suppressing component to smoking, right? And so they do that. Well, we tell them, look, we are right now putting you in a program that is geared to helping you stay healthy. You're going to see a nutritionist every month. You're going to see a psychologist about the weight issue. You're going to see a weight management experience surgeon very frequently. So we're here to support you. Do not worry about the issue of weight gain because we can give you tools to minimize that. It's far important to stop the smoking. So I don't want that to be a concern from them because the weight issue has a solution. You are in a bariatric program, and that's what we do is we help people lose weight. So we will take care of it with the surgery, with the safe performance of the surgery, but we need to get out of that smoking. And that's what I tell the patients about it.
So I do want to give one update from our practice. I think we discussed some part of this. I always actually bring it up, but one issue for our patients is really important is utilization of patient portal. Yep. So because we do video visits, telemedicine is the only, the most efficient telemedicine only happens when you use your patient portal, IQ Health. So United Medical ACO patients, CHRIAS and ASC patients, please download the app called Healthy Life. This is going to give you access. This is available in the app stores. This is going to give you access to your chart. Your chart, your access is power, our patients. So access is power. So not just for the telemedicine, but being able to actually efficiently reach out to your upcoming appointments. Here, your scheduling new appointments. And you see like it says view available e-visit. So it's already just designed for you so that if you utilize the IQ Health, this is our homepage in iPhone, I guess this one is. So then you'll be able to have this type of a quality telemedicine experience. And we also are worried about certain security issues with the connections. We want to make sure that we respect the privacy of you, and we also respect our physicians, providers' time. So please make sure that if you don't have an active portal, ask next time. You actually will be getting patient reminders on the either text message or a voicemail. Then please use the patient portal, and then your video visit will be extremely smooth. And then this way we can actually serve you better. That's our goal. We care about you. We care about our patients. We want to maintain our patient satisfaction scores. Earlier, I was just sharing in the United Medical session the hospital patient experience scores from Medicare, and they're like less than 60%. We are at 99.4%, and I take a great pride of that, and then I want to keep that up, and then I want to maintain that. We want to maintain that, and then having the technology, utilizing the technology properly is going to be part of that. Please, use the system properly. Now, next week we have first Tuesday we have the St. Francis CHRIAS and ASC support group meeting. If you have a surgery from CHRIAS, that's an exclusive only for our patients. The support group is at 6 p.m. on Tuesday. And then next week, we'll have our session at 1 p.m. And Dr. I promise you, I'll be finishing the other event before 1 so that we won't be late for this. But we'll be back next week. Thank you so much.